Assalamualaikum and hello everyone. I'm Izzati Qurratu'aini, one of the student from Bachelor in Medical Lab Science in University of Selangor. To fulfill the requirement for my internship, I need to present one of the case study in my intern place, which is in Cerebral Pathology Pangi. The title for my case study is Severe Dengue in Foreign Worker with Thrombocytopenia and Haemolytic Anemia. The aim for my case study is to investigate the relationship between dengue infection in foreigner with thrombocytopenia and acute hemolytic anemic condition in the patient. So there is 3 keywords need to be highlighted in this case study, which is dengue infection, thrombocytopenia and acute hemolytic anemic condition. Introduction. First of all, what is a dengue? Dengue is a flavivirus disease that commonly found in Southeast Asian countries. Dengue is suspected when platelets count drops from normal range during full blood count tests, whereas the count is less than 150,000 grams per liter. FBC was done to identify hemoglobin count, red blood cell count, white blood cell count, and platelets. To confirm the dengue fever, NS1 antigen kit and IgM-IgG serology tests were used. The other tests included for my case study is the biochemistry testing, where we need to identify the total, direct, indirect bilirubin, AST, ALT, LDH, and CK. Also included urea and APTT were done to briefly analyze the hemolytic condition. The highlight keywords is thrombocytopenia. Thrombocytopenia is divided into 3 stages. The first one is mild stage, where the range is between 100,000 to 150,000 microliter, while the next one is the moderate stage, where the range is between 50,000 to 99,999 microliter, while the severe stage or less than 50,000 microliter. NS1 kit detects antigen after at least 2 hours of the exposure to illness, while for IgG and IgM rapid test kit, it only detects after at least a week of exposure of illness, because both IgG and IgM are antibodies. IgM comes first and IgG for later response. The picture illustrated in the slides showing the kit using case presentation. Showing in the slide is the patient demographic, where the patient is a 28 years old gentleman from Nepal, and he is working in construction near Section 9 Bangi. He lives in rented house in Sungai Ramal Kajang with other housemates. Showing here is the table 1 for the patient hematology results. From the table you can see that the day 1 until day 5 result for hemoglobin count, red blood cells count, white blood cells count, platelets, and also ESR. If you see the pattern for the hemoglobin count, you can find that on day 3 and day 4 to day 5 there are sudden drop, where you can find the next result, which is the platelets. From day 1 to day 2, there is sudden drop and there is another drop on day 3, while it increased back during day 4 and day 5. Red blood cells showing the decreasing pattern and white blood cells showing an increment. For ESR, the values are inconsistent, thus it slide show the normal range for the hematology result for hemoglobin, red blood cells, white blood cells, platelet, and also ESR. Table 2 show the biochemistry result for the patient from day 1 to day 5, where the serum bilirubin, total direct and indirect, serum enzyme for AST, ALT, creatine kinase, LDH, urea, APTT, and serum lactate. You can see the pattern on serum bilirubin, serum enzymes, and all others biochemistry testing for this patient are out from normal range. Next table is serology testing for dengue. As I mentioned before, NS1 antigen test kit, dengue IgM, and dengue IgG test kit were used. So the results show that on day 1 and day 3, NS1 antigen showing the positive result, while dengue IgM show on day 5 of illness and dengue IgG show after a week of the exposure of the illness. The patient also have the symptoms: high fever with chills, he also vomiting, he had a flu, cough, joint pain, and abdominal pain, but he denied myalgia and other systemic symptoms. We will proceed to discussions. From table 1, platelets count decreasing during day 1 until day 3 of illness from 92,000 gram per liter to 35,000 gram per liter. This pattern show that the thrombocytopenia condition. According to Medagoda K et al., it may be caused by depression of bone marrow, direct invasion of virus in monocytes, and platelets also rise in consumption and destruction of red blood cell. So I can say that because of depression of bone marrow, destruction of red blood cell also uh, increase because of the invasion of virus in monocytes. Thus, platelets needs in bone marrow increase. It causes the platelets cannot go to the bloodstream, so that's why the blood in the blood the platelets count are low. Next, from the same table, table 1, the results show that on day 4, platelet count start elevated back from 35,000 gram per liter to 94,000 gram per liter, showing an improvement. But in contrast with hemoglobin value, it dropped drastically from 150 gram per liter to 90 gram per liter. The physician mentioned that the patient has no blood loss and the coagulation of the patient also normal. Thus, it manifests the patient develop hemolysis. From table 2, it states that on day 1, it shows high indirect bilirubin count compared to direct bilirubin and also high level of AST and LDH. This condition show that there is hemolysis occurred since day 1. High LDH cannot be the sole indicator for hemolysis in dengue. It is because even in normal dengue patient, also high LDH will occur due to ischemic tissue injury in body. Besides that, there is another disease or disorder that share the same biomarkers finding, which is rhabdomyolysis. But because the patient has no clinical symptoms for this illness, and also when we run renal profile test, the result were normal. In the same table, there also mentioned the APTT measurement. It stated that appetite measurements are longer than normal for this patient, so disseminated intravascular coagulopathy was considered. But we do a peripheral blood films, so it showed that during the microscopic observation, it showed the lack of microangiopathic features, where it's one of the characteristics for disseminated intravascular coagulopathy. FPTT was done together with prothrombin time (PT) and also with fibrinogen. Both prothrombin time and fibrinogen result were normal. FPTT with normal prothrombin time and fibrinogen is one of the features for severe dengue. It is because due to imbalance in coagulation. Another highlighted keywords in this case study is thrombocytopenia. Okay, thrombocytopenia is where platelets count decreasing. In this patient, platelet counts were also low, but this characteristic may be seen in bacterial sepsis and also other viral infection. So it cannot be because of the thrombocytopenia. We will say that confirm this patient have dengue. It's not that, but because the characteristic for thrombocytopenia will maybe caused with other viral infection too. Thus, having prolongation of APTT will help to differentiate dengue infection with other infection. Next, based on table 3, the investigation for dengue confirmation were done. We used NS1 kit, where it showed positive result on day 1 and day 3, while IgM and IgG rapid test kit show positive result on day 5 and day 7 respectively. This is because NS1 antigen kit detect antigen, while IgM IgG kit detects antibodies. Antigen can be at least for 2 hours after exposure of illness, whereas antibodies IgM produced after days of exposure, where IgG is produced for later response after. Next is conclusion. Can I conclude in my case study is that as a conclusion, the serology testing for dengue infection via NS1 kit and IgG IgM kit show positive result together with full blood count test, where platelets number drop from normal range, confirming the dengue infection diagnosis. While I can confirm the patient have acute hemolytic anemic because from biochemistry testing, it is explained that the patient had acute hemolytic anemia with severe dengue. Whereas thrombocytopenia may be caused by dengue infection that depress the bone marrow production of monocyte and also the platelet. References. These are some of the references that I use to explain my case study. The list are a lot or more, but I just include at least 3. So I think that's all of my case study.